Good evening, everyone, and thank you for joining us for tonight's Woo You event. Tonight, we get to hear from Dr. Joelle Holland on becoming myopia control experts. I'll be your host tonight. My name is Dr. Ariel Sorenzi. And a big thank you to Cooper Vision for exhibiting at this event. This will be worth 1 hour of CE credit, so please be sure to attend for a minimum of 50 minutes. For your COPE certificate, if you could fill out the survey link that is in the chat, it'll also be there when the webinar ends. Your CE certificates will be delivered via email and sent to ARBO with your OE tracker numbers. But we will have a QR code at the end of the event, so if you have your OE tracker app, you can scan that at the end of the presentation. Otherwise, your certificates will be mailed within about 4 weeks. For questions, we're actually going to save them in the sponsor room with Cooper. So please join us in the Cooper room for Dr. Holland to go over the questions there. Let me go to the next slide there. Cool. So it is my pleasure to introduce our speaker tonight. Dr. Joelle Holland is an optometrist specializing in myopia management and dry eye disease at Complete Eye Care of Medina in Medina, Minnesota. A graduate of Illinois College of Optometry, she was named the inaugural myopia change agent for Minnesota for 2024-2025 by Cooper Vision and the American Optometric Association. Dr. Holland is passionate about continuous learning and is excited to share her experiences from her thriving myopia control clinic, where she creates personalized care plans and fosters lasting relationships with patients and their families. She takes a holistic approach, emphasizing education and lifestyle changes to ensure the best outcomes for children and their families. Here are her financial disclosures, all of which have been mitigated. And I will have you take it from here, Dr. Holland.
Okay, thank you, Dr. Srenzi. I really appreciate you and Wu University for inviting me to talk about literally the thing I love to talk about. So I hope everyone that's listening today enjoys, takes a nugget away from what I talk about, and yeah, I'm excited to chat. So my lecture is entitled Integrating Myopia Management into Primary Care, Practical Strategies for Success, and I'm really trying to emphasize breaking some of the myopia management myths. So just a little bit of an introduction to who I am. This is who I am. This is why I do what I do. Yes, in the center is me and my like professional photography, like photo work headshot. But surrounding that is like literally my passion and really my reason why I dove into myopia management and like specific specialty pillars within our practice. I'm an associate optometrist at Complete Eye Care of Medina, and Dr. Gina Wesley is our owner, and I've been with her for 8 years since I graduated ICO in 2016, which is kind of crazy to say out loud. Maybe in this photo you recognize another optometrist. Yes, my husband is Zach Holland. He also graduated from ICO in 2015, and he does ortho K too, but I just do it better. So here we are. So yeah, this is why I do what I do, and so this is the reason why I do everything the way that I do it, and this is the reason why I wanted to come on today and share my passion so that you guys can build futures and build careers that you love going to work and bringing things back home to children or animals or parents or crafts or whatever you love to do. Um, so here are my learning objectives today. So I've got 6 of them. We're just going to go down the list. I'm going to debunk some of the myths. I want to provide you with practical strategies for integration. I want you to understand what technology is like maybe needed or not needed in your clinic because not everybody works in like big myopia control clinics. Like I don't even work there. I mean, we're in a private practice setting. We see about 50% primary care, and then we see about maybe 25% myopia management. We see 25% dry eye, and then we run like 2 or 3 kids through VT every 6 months. So I'm hoping that I can connect to a lot of different optometrists out there right now that might be in settings like me, but this also could be put into any other type of setting, whether you're working with ophthalmology, or you're in like commercial setting, or you're in a hospital, or you're in private practice, a huge one, a small one. I just hope you can take something and know that you can integrate myopia management into wherever you're at. We're going to talk about empowering our teams for success. I'm hoping to show you that you can create a structured and scalable myopia management plan. And then lastly, I just love to enhance my patient and parent communications. That's really what my backbone of like what I do and why it's successful. We'll end with that. Excuse me. So the misconception. I feel like there's so many misconceptions with myopia management. And I feel like one of the biggest ones is that this is where all of your attention has to be. Like, if you're not doing all in 100%, like the whole thing, then you can't do it. And I just don't feel like that's true because that's not where I started either. I started with one patient at one point. So I think to get to that, to debunk that misconception is that we just have to stress that we don't have to overcomplicate this. Like, it's really not that complicated. You just have to break it down for truly what you want. Inside of that maze, you're going to see a QR code, and that QR is going to lead you to a Amazon link to Don Miller's book. That is like it's called Story Brand, Building a Story Brand. I don't know, maybe you guys have read it before. I'm sure a lot of you have. But it is truly what reset myself and Gina's like thinking on how to communicate with patients and to not make this so gosh darn complicated. Because we all know every patient is so different and can be so complicated. And this parent wants this, and this kid wants this. We have to build ways that, like, yeah, we know what we have in our head and it is kind of complicated, but we have to be able to bring it out in a not complicated way because they're not going to listen if it's confusing. And that book was a huge roadmap to that. And he's got like tons of other stuff where it like connects to like products that he can use and teams you can call and all that stuff. And you can do that too. But like it is truly amazing. I really would encourage you to read it if you have time. Okay, so myth number one. I don't know enough to start. I still don't know enough to start. I don't know. Like I struggle with feeling like the imposter syndrome. I think that is real. But I have just over 100 kids in Ortho K, and I still am not the smartest cookie like in the jar. I don't feel like you have to know every curve, reverse curve, how do you move it up, down, side to side, how do I make like you don't have to know how to do all of that, all the dual focus, where is atropine actually affecting the eye to do this type of stuff. Now, it is important that you know what's going on when you're doing it. So I think you do need to educate yourself and you need to get passionate about it. But I would emphasize more of getting passionate about it versus like being so timid that you won't start because you don't feel like you know enough. So here are like a bunch of different resources, and that's kind of what this like lecture is going to be about. I want to give you the tools to be able to use resources that I've used to build this within your practice because I can't give you like I can't write a protocol for you. You can't take my protocol because we all have different staffing. We all have different patient bases. We all have different economic we all have to like I don't accept vision insurance anymore. We dropped that 2 years ago. We accept major medical plans, but I would say I think we're like right now at 30 or 40% cash like clinic. So my setup is so much different than yours. So I want to be able to give you the resources that you can go and learn on your own and create what you need to create. So here are some conferences that I think are like just the bomb. Number one, Vision by Design. If you want to know anything about myopia management, in my opinion, you need to go to Vision by Design. And I feel like I talked to a lot of people that have like never heard of this before. Vision by Design is phenomenal. I've gone, I think every year for like the last like 5 or 6 years. This year it's in Florida. That QR will take you to the website to get registered. But you're going to learn it all. I mean, you'll learn the soft myopia control, you'll learn the ortho K, you'll learn the technology, you'll be at the shows that have all the instruments and all the things. But that one is huge. And then within Vision by Design is Supercharge Your Practice. And Supercharge if there's any Supercharged fans out there, I've been twice. Dr. Nick Despeditas is who runs that, and he's like the myopia management guru or like the ortho K guru. He is like probably unknowingly just a huge mentor of mine. I said I've been twice, and he's just a force to be reckoned with. His energy, what he brings to Supercharge, he's going to like, it's a whole day event, and he's going to line out how you build whatever pillar you're trying to build. And you could take what he's learning and you could put it into dry eye, you could put it into vision therapy, you could put it into myopia management, you could put it into specialty lenses, you could put it into whatever. But he's going to give you all the tools of like the protocols and what do I charge and how do I talk to patients and how do I get inspired about it and how do I tell my staff about it. So if you want to go and really immerse, it's expensive, but you come back and you fit two kids in ortho K and you've already paid for it. So Gina sent me to that when I was like fresh. I think I was like a year out, and I like that just like lit me up inside. And then I went back just a couple years ago, and again, he fires you up, and it's amazing. So that QR will take you there. Couple other conferences that really emphasize on myopia management are the International Myopia Conference. This one is literally international. I've never been. It's in like China and Brussels and like it's Greece, I think is like, I mean, it's all over and it looks super cool. I've never been. I'd love to go one day, but that's a big one for myopia management. Myopia Summit is in Canada. I went to the Dry Eye Summit in Canada, and they're kind of like sister things. I know Kate Gifford was at the Myopia Summit, not this most recent one, but the year before. So they have really good names there, and it's just focused on myopia management, which I think is rare to find. So the Myopia Summit would be one to look into. The review of myopia management, like their webinar series, is kind of like a conference. You can go and like rewatch those. Academy has a myopia track. GSLS, we just went in January. We usually go to that every year. Zach and I go. Zach does ortho K, but he does tons of specialty lenses. He goes and does the specialty lenses. I go and do the myopia management and some dry eye, and it's an awesome conference to go to. And then AOA this year is in Minneapolis. Yay, that's where I'm at. So I will be speaking at AOA, so I know that there's going to be information about myopia management there. So that link will take you to AOA. Publications and websites, the myopia profile. If you guys don't know about this, this is huge. This is amazing. I think I use it every week. Kate Gifford out of Australia and her husband created the myopia profile, and they also created something called mykidsvision.org. And that's one that you can like send parents more information. But for us to learn as doctors, the myopia profile is where we go. And it's all literature, it's all research. And she's got resources on there for your practice. So like you can learn yourself, your staff can learn, they can take modules and they can get certificates and they can do, so it's a phenomenal website. And she continues to grow and she continues to make it awesome. But it's really cool. And then for the kids version, mykidsvision.org version, that is really like in layman's terms, how to educate parents. There's also like a risk analysis that you can send to parents too, and they can kind of click through like, my kids this are already myopic and I wear glasses and they're on their screens this many hours, and it'll give the parents a risk analysis, which I think is really cool. So that website is phenomenal. That link will take you there. That one's huge. The review of myopia management, again, just for publications and websites, I think is an awesome resource. AOA, under their resources, they have like their practice protocols and their standards of care for myopia management. I think that one's really cool. And along with that, you'll find the Myopia Collective under the AOA. And being Minnesota's change agent for the CooperVision's and AOA's Myopia Collective, I firsthand got to go to Chicago and they like educated us. And the Myopia Collective, we get weekly emails, but you guys get quarterly emails if you just sign up for that. And it just shows it's kind of like, what is AOA and Cooper, mainly AOA, what are they doing to further the education of myopia management? So they're going to be sending out clinical pearls. There's things that you can like post to your Instagram. There's things that like marketing materials, all that stuff is in there. And I think and like letterheads that you can send pediatricians. They have a lot of really neat stuff in there. And I didn't even know about that until I went to that conference. So that's a really neat one to start educating yourself. JAMA, Brian Holden Vision Institute, Eyes on Eye Care, and then Vision Source. If there's any Vision Source practices out there, they have practice protocols within there on Insight. And I have a link to that one later on. But I didn't quite know about that one until Chris Wolf came to Minnesota and was like talking about it. And I was like, this is available to us. So if you are a Vision Source practice, and I don't know about any of the other buy groups, but Vision Source has that on Insight, and it's really neat. Okay, so myth number two, I need expensive equipment to get started. Um, Boo. No, you don't. You need the right equipment to get started, not excessive. We don't need to buy every machine. And especially when you go to like conferences and stuff, it's so tempting. Everything's so shiny and new and text, like write-offs and all the things, but just get what fits for you, what your goal is. You don't need all the fancy stuff. And if I had to sum up this whole like slide in one thing is get a topographer. Like just get a topographer. If you haven't started or you have started, just get a topographer. I know Gina, right before I joined the practice, right after I joined the practice, we bought a Medmont, and we used Medmont for many, many years. And then I think it just died. And then we got an Oculus. So I've used both. The QR codes are both for there. And I know there's other topographers out there, but those are just the two that I'm familiar with, and that I have knowledge about. And I think they're both awesome in great ways, and they both have negatives in some ways, but just get a topographer. For dual focus contacts, for like my sight contacts, you don't need a topographer. You're just fitting a soft contact lens. Like it's not difficult. I had Cooper was up here in Minnesota and we were like talking through that, and it's like it's just fitting a contact lens. It's just a soft contact lens. So this is one where if you're like, I'm not ready for Ortho K and like all the things in topography and like I don't know what I'm doing. I don't even fit it. It's a lot of protocol steps. Do dual focus contacts. It's fitting a contact lens. And so yeah, you need to like kind of build your protocol around like pricing and your contact lens fitting price and stuff, and how many times you're going to see the patient throughout the year, but you literally need no technology. So that one really has no excuse as to why not every optometrist should be fitting a dual focus contact lens. What you don't need is an axial, like an A scan. If you want an axial length, I have one. Um, Honestly, I don't use it all the time. It's just one extra step that like, I mean, if I really wanted to be super sciencey about it and like I could do that for every patient, but especially my like older established patients, I don't run it on anybody and I just fit them in the lenses. And if their vision's not changing, then we're happy. And if it is changing, then we change course or we adjust power or we talk more. Why are you wearing the contacts every day? Like what's going on? Um, and again, I know that there are probably lots of optometrists in here that like love the science and love that, and love the A scans, and like we need you, we need you. But in our practice, like efficiency is everything. Like we don't make money. I can't pay the staff. We can't do that if we're not efficient. And so running every test on every single patient with every instrument is just not our reality at our practice. And so we don't do that. So the kids that I have in my site, the kids that I have in natural view and like just soft myopia or soft multifocals, I don't run an A scan. I just run them like a normal contact lens patient. Ortho K, of course, I needed a corneal topographer. I don't even want to like mess around with not having that. But I do know that Gina, when she first started, she had a keratograph or she had a keratometer, like the one that's on the auto refractor that gives you like this much of the like central cornea to fit like get a K on. But she did that for a couple years. And I think like depending on where you're at with your technology, if you have that, start there. Order empirically, get set up with whatever company that you want to get set up with and give them a manifest, give them their Ks, give them an HVID, and you start there. So like you don't need the fancy stuff. Like it's just an excuse to not do it truly. And then atropine, again, kind of like dual focus contacts, you don't need anything. You prescribe an eye drop. I use a compounding pharmacy locally here in Minnesota. It ships them the drops. The patient pays the pharmacy for the eye drop, and then they pay me my doctor fee to manage them. And when they come in, we do a refraction and we watch for change. Some of those kids I do A scans on, the ones that like I started with the A scan before atropine, but many of them I don't. And we just go along with that. So again, that is one that doesn't need any technology, and you could start today if you wanted to. Um, So I'd like to debunk this myth. I don't think you need expensive stuff. I don't think you need a lot of stuff. You need a topographer if you want to do work, okay? Like as simple as that. And I want practitioners to really like I want us to like enjoy the ride too. I feel like in our society it is one thing where it's like I can't do it until I have all the fancy things and all the like labeled folders and all the perfectly marketed like material and everything looks pretty and beautiful. But like enjoy the ride. Like I try to speak this into like younger optometrists and kids in school still too, because I'm like, you don't want everything right when you get out. Like enjoy that. Zach and I, it took a long time for us to pay off our student loans, and we I wouldn't say we enjoyed that ride, but looking back on that, like we enjoyed the process that it took, the hard work that it took to get the machine to pay off the loans, to get to the point that you wanted to be at. So don't be hesitant to start if you don't have like everything. You know, you can work through it as you're going because it's not like a million patients are just going to jump into your lap right when you first start doing this. And if you do, good for you. That's pretty awesome. But Dr. D also told me, I remember the stat, and forgive me if I'm probably going to say this wrong, but I am not a baseball fan. I don't really know much about baseball, but like I'm pretty sure batting 300 is like amazing. And then that's like 30% of like every ball that's thrown is hit. Like that's not a good percentage. But he was like, that's what I'm doing. Like I talk about this 10 times, maybe three people are going to say yes to it. So you're going to have tons and tons of opportunities to like get better and better at this. So you don't need all the things. Get a topographer, start there if ortho K is where you want to start. Okay. Myth number 3, all my staff or my staff won't be able to handle all this, so I can't do it. Like they're not adaptable. I can't train them all. I don't have time to train them all. Um, it depends on the setting that you're in, but we have to train and empower our staff because they are our biggest asset. And if they're excited, patients are going to be excited. And we can't do it all. Depending on the size of practice you're in, maybe you do, and that's cool. So yeah, you can't do that all. But like we can't do it all. So the well-trained staff is going to make this implementation like of this whole thing seamless, and it's really going to boost all of our patients' confidence. So here are some resources for staff training that I've used, and I would really encourage you guys to look into. The myopia profile, again, Kate Gifford has free and paid trainings. And I think it's just really neat because as the staff or yourself or your associate doctor, or whatever, as they're working through these modules, they do get like little certificates. Print them, put them up on the wall. Like, no, like patients don't know. Like, I would love it. Like, put that up on the wall. Like, show that that's really important. Bring your staff to Vision by Design. They have a staff track that patients can go through or your staff can go through. And one thing that like I feel like Dr. Wesley and I always kind of like shudder on a little bit is like, oh, like, well, they're going to teach them things that we don't like that we wouldn't want them to do. I'm like, that's okay. I learn things all the time that I know not to implement into my day to day. Like I can sit through a lecture and I can be like, well, I'm going to take that, but I'm not going to take that. So when your staff comes back to you with all their education, and I would encourage you to go with them and then like make it a staff outing. Zach did that with his staff at GSLS one year, and I feel like that brought a lot of camaraderie back to his practice. And like take him out to dinner and talk about what you learned and how you would implement things, like make it a retreat if you can afford it. And I think that would be really cool. And Vision by Design does a really good job of like separating things. There's workshops there. They can go through like topography with Randy Kochma. Like, are you kidding? I want to go do that. So it's a hands-on training at that conference, which I think is really cool. Cooper Vision does have myopia training modules as well, and they have these myopia management certifications. So this is like a 2 QR code step. The first QR code will just get you to like Cooper's like myopia website, but then the second one is where you have to like sign up to get into that certification and that training. But that's a really neat one. Again, like empower your staff to be like, you get through this training and we're going to go to this next step. We get through this training, we're going to go to this next step. The more that I've worked like 8 years in our practice, it's when I feed into the staff like actually feeds into me. Like, and it's just this symbiosis that I really love. And then, you know, you kind of like how I work sometimes. I'm like, I'm just in my own lane. I can stay, I can do my own thing. I don't need anybody else telling me like, raha, woohoo, you're doing a good job. But then you start to see everybody kind of fade away from you. So you have to just kind of actively continue to stay in with them. And this is a great way to do that. private practice coaching groups, especially like specifically Treehouse Eyes. Not that you have to be a Treehouse Eyes provider, but I'm fairly certain that when I researched this, we did not do this, but they can come in and they can help coach. And I know even a lot of the like Cooper Vision reps and Euclid reps and Paragon rep, like if you have a rep in your area, they are going to be more than happy to come in and help train. And the same thing, like maybe they're going to be talking about things like, oh, we're going to do a consultation. Oh, we don't do a consultation. We do it in the exam room. Oh, we do it in the exam room. We don't do a consult. Don't get so like stuck in the minutia of like, I don't want them to hear this. I only want them to hear that. Talk about it afterwards, then figure out your plan. Because this truly is a myth. Like your staff can handle it. I think we're in a society where I feel like everyone feels so overwhelmed and we can't work. No, we can. And that's how we're designed. Like we're designed to work hard and we're designed to want to continue to push forward. So I would challenge you to push that into your staff and enable them or empower them, not enable them, empower them to take this on because I really think that they would enjoy it. And having like their own little baby would be really great. So what do they actually need to know? I just listed out some, I won't read them all, but like I just listed out some things that, I think if you were to like walk around any of our staff at our clinic and I were to ask these questions, they would have the answers to them. What is myopia management? Who's a good candidate? Like our staff, even like our optical staff, like that they don't even like mess around with this that much. They would still be able to answer the majority of these questions. And so just those 5 questions, if you can get to a point where you've trained your staff well enough that they know some of those answers, I think you're on the right track. So that would be myth number 3. Myth number 4 is kind of in that same space that not only do my staff have to be empowered and like know all the things, but then I have to have this like dedicated myopia specialist who like works through all the things and she's the only one or he's the only one that knows what's good. No. The key to this is that we have to align as a team for consistency. It doesn't have to be your clinic's whole focus. Like it's not the whole thing. And I think sometimes like even like you guys listening to me, like this is not my clinic's whole focus. This is not what I do every single moment of every single day. It's a huge part of our practice and it's something that I truly love. And when I see these patients every day, when they're sprinkled in every day, it gives me joy, but it's not our whole focus. So starting to create these protocols and knowing kind of what your practice looks like and how this is going to look is really important. And so these 2 QR codes back to supercharge your practice is going to help you get through like all of that. Like, what does this look like in my practice? And then the other one is for vision source doctors, but I was really impressed by the myopia management protocol that Dr. Serenzi and Dr. Wolf put together. It is really top notch. So all the vision source doctors out there, take advantage of that and utilize that and try to build off of that to put it into your own practice. Because again, I can't tell you like how to align your team. I just don't know anything about your practice. So I want to give you the tools in order to do that. So setting really clear guidelines for identifying candidates is like a really huge thing. And that's more of the doctor, but the technician that's working up the patients, they can be involved in that as well. Designating who discusses the treatment options in my clinic, I do. Like I don't have I have a myopia specialist, staff member that helps with like a lot of the questions that our other staff doesn't know. But that's not necessarily what every clinic needs to do. But I talk about the treatment options. So I designate who, and so does Gina. Like we share this. Like another way this myth can kind of go is like only Joelle Holland can see the myopia patients, and Gina's going to only see the dry eye patients. We don't do that either. We keep our own patients, but we each see our own patients, and we each see each specialty. We created our own templated like educational materials to give to parents. I did it on Canva, like exactly how I would want it. I used StoryBrand, like Don Miller's like approach, and I built something off Canva for free, and we print them and they're trifolds and we give them to parents. We created like QR codes that have more information with like frequently asked questions on like pricing. Um, and that to us, that works really well for us. And then our staff and our virtual assistants are helping reach out to those patients after they're gone. So we try to ensure that every team member can answer the basic questions, but there definitely are ones that are more high level. And our in our clinic, our office manager duels as like our myopia management liaison. And a lot of those questions get directed to her if they're more high level, and then to us for sure, because I will gladly answer an email. I will gladly call a parent. I have no problem doing that. Um, and then like the follow-up on how we're monitoring, like what does your program look like? How often are you seeing these patients? Are you seeing them every 3 months, every 6 months, every 1 month? Like what does that look like? And that just takes time. And if you have no idea even where to start, I would divert to Supercharge Your Practice, or the Myopia Profile is a really good way to start to get some protocols like set out on what might work, or reach out to, if you want to go MiSight, if you want to go Ortho-K, if you want to go atropine is its own thing, but reach out to the reps too. Like they've seen so many practices, they know exactly what might work best for you. So that is kind of debunking the fourth and final, what I like to call myths. We're going to talk about a few more things, but myths around myopia management. So overall, like the overall general like theme is that just keep it really simple. It doesn't have to be so like high level and that only these specialty clinics can do it. You can start. You can start with Ortho K. You can start with MiSight or dual focus. You can start with atropine today. Just sit down and write out a couple protocols, meet with your office manager, and talk through how this would kind of work for you guys. A couple other things that I felt like were really important to talk about were addressing parental concerns effectively, because this is like, I don't know if it's like the bigger part of the equation, but it's really, yeah, like I know I want your kid to start Ortho K. And yes, the kid is like really interested in it, but these parents have a ton of questions. And depending on the ethnicity of parent that you're talking with, they could have more, or they could have a lot more. So this was something that I put together, just like a couple of my top four questions that I hear from parents all the time. Is how much does it cost? Is it safe? Will it work? And can my kid actually handle this? Um, how much does it cost? Like, of course, I can't talk through like what my like pricing is, but I layer things. There's levels for each one of our treatments. And Dr. D's, again, the supercharge can help kind of break down a lot of those protocols and like analyze chair time. So does the Vision Source myopia management protocol sheet that can help break down chair time as well. But what I said and what Gina said in the very beginning is we had to charge enough to do what we wanted to do. And we can always it's hard to come down. We can always go up. It's hard to come down on price. So the price that we set, it's expensive, but we are building a brand behind it, and we are becoming part of these families. And I really feel like they are, I don't want to say that they're not batting an eye at how expensive it is. They stop on it for a second, but once they really see what this program includes, in my opinion, they jump on. So just to kind of give you like a little insight into like what our practice is like, we do consultations for myopia management. So if I see a patient in a comprehensive eye exam, and I'm identifying a myopic kid and I want to start some sort of myopia management, we'll have them back for myopia management consultation. In that consultation, it's kind of like, I think our percentage right now is like 98%. If we can get a kid into like a consultation, 98% of them are moving into some sort of therapy. So I think the way that we do this is super important. And I'm just going to pick one part of my consultation that I feel like has really like blown it out of the water. And this came from Dr. D at Supercharge 2 years ago when I went for the second time. He talked about the importance of talking to parents about screen time. And I was like, well, of course they're talking about screen time. Like, what? Like parents will ask me a couple times, but like you be the one to bring it up. And I was like, why does that matter? And he was talking about how when I started doing it, I couldn't believe the response from the parents. And I talk about four things specifically when it comes to like screen time. I talk about the amount of time kids should be on screens, and we go through that depending on like the kid's age. I talk about the distance the phone or the iPad or whatever should be from the kid's face. And that leads me into like posture, and that leads me into like axial elongation due to shortened working distance. So we talk about the Harmon distance is what we talk about with that one. We talk about blue light exposure, and specifically, I go from blue light exposure into melatonin deficiencies, and then from melatonin deficiencies into lack of REM cycle, and lack of REM cycle into lack of growth hormone release, and how like our kids just aren't getting the rest that they need. So we talk about that. Um, and it's amazing to watch what these parents like that they're like literally drooling at me as I'm like talking to the kids about the importance of this. And then the last thing we talk about is eye contact and like communication, and how I'm so nervous for this like this society and this generation of kids to not be able to talk to people, not to be able to hold a conversation, not be able to look you in the eyes and have a conversation, not be able to ask you how you're doing. And when I walk into an exam room, and if I always address the kid before I address the parent, but if I address the kid and I'm like, hey, how are you doing today? And they're like, I'm good. How are you? And I like literally stop in my tracks and I look at them and I say, I want to thank you so much for asking me how I'm doing today. And then I tie that into this conversation when I'm talking about communication, like just like in the beginning of the exam today, you asked me how I was doing. Keep doing that. Keep do and so, and this all talks about screens, because if we're stuck in the screen, we can't make eye contact, we can't connect. And then at the very end, I usually look over at the parent and I'm like, I'm also talking to you too, because you need to work on this as well. And the kid kind of smirks. And so that conversation about screen time, about being with the family, about going outside, about reducing screen, getting it away from your face. I look at the parent and I said, when you join this program, like when you join this myopia management program, we're going to be having this conversation every 3 months. And the parents are, and the kids are like, oh, and the parents are like, yay. So that is like my one nugget. Like that has been a game changer for me in getting way closer with the parents and getting them on my side, because I truly do care about this. I'm a minus 475 OU. I mean, I get it. I'm nervous about all the myopic degeneration and all the things too. Um, so I get it. So I am here. I want to advocate for this kid, not only for their vision, but for their overall everything. Um, we went to like one of my patients was Anna in Frozen Junior at the local middle school. One of my patients kind of like fell off the bandwagon and didn't want to wear his lenses anymore. And his mom was really like pushing at him to wear them, and she couldn't figure out what was going on. And him and I started talking without mom in the room, and he's talking about like baseball and how he really likes baseball. And I made him a deal. I was like, okay, fine. I was like, I want you to come in every single week. We're going to take a topography every single week for me to ensure that your vision is sitting at 20/25, 20/20 every day, and or every week, and your topography images are clear. And if we can get through 4 weeks of you doing this, I'm going to buy you tickets to the Brewers Twins game, because he was a big Brewers fan. I'm going to buy you tickets to the Brewers Twins game right here in the exam room. And like, I think he was like 15 or 16 or something. So like kind of like moody or whatever. And he literally like lit up, and he was just like, oh my goodness. He came back every week. He came to the fourth week with his dad, and his dad didn't know we were doing this for some reason. I feel like they would have talked about it at home, but his dad didn't know. So it was the fourth week, and he completed it. And we bought tickets right there. And his dad literally was like, I thought he was going to start crying. He was so in awe of like what I was doing to connect with this kid, because yeah, I care about the vision. Yeah, I care about Ortho K, but like I care about that way more. And that's what's bringing me joy into implementing this into primary care. Like that's what keeps me coming back. And that's what keeps all these parents telling all the other parents that like this is fun here and we should do this here. So, addressing parental concerns, I feel like I hear less parental concerns when I become better friends with the family. And so that connection piece, as simple as, even if it's not a myopia management consultation, in every kid's eye exam, I am literally having that conversation about go outside, screen time, distance to face with screen, blue light exposure, and communication. And that has nothing to do, I mean, it has everything to do with an eye exam, but it has nothing to do with an eye exam. And I feel like that is what's drawing these kids in so that we can get them to the next level and save their vision with myopia management. A couple of those QR codes there, like link over to Myopia, mykidsvision.org, about is it safe and will it work? And it's more of that, like how to educate it to the parent. So that's a really good website to do that. And then the last one, can my kid handle contacts? I just love Justin Kwan. So if Justin Kwan's out there, I really appreciate you. And he always says kids can do hard things, and they can do hard things. And they're in the mode of their life, depending, like, I don't know, our average kid starting is probably somewhere between 7, 8, 9, 10, 11 years old. And like that is the prime of their learning years. They just learn. Like why do I think that they can't learn how to do this? All they do is learn all day. Let them learn this too. They're really good at it. Our youngest kid that we had do it by himself was 7. But I had a parent putting ortho-K lenses in a kid's eyes when they were 5. His older siblings were ortho-K, but he was 5. So like kids can do hard things. They can handle contact lenses. And when you see them master it, that's the even cooler part. Yesterday he's high functioning on the spectrum. But he just hit his 1 month like finalization, and the parents were so proud. I was so proud of him. Parents were so proud of him. His mom called me the day after the day of the consultation later that night. I gave her my cell because she had some extra questions she didn't want to ask in front of him, mainly to do with like his autism. Um, and she was just a little bit concerned, but she was in the same space where like kids can do hard things. Like I think he can do this. And now we're like 1.5 months out, and he has mastered this to the nth degree. And the fact that he can now use this accomplishment as a stepping stone to like the next hard thing that he's going to have to do, I think is just the coolest thing. And so like whatever it is, a new classroom, a new pair of shoes that are uncomfortable, a new routine, a new this, well, remember when Ortho K was like new to you? It took you 30 days and you mastered it. And I don't even have to peek my head into the bathroom anymore. And I totally trust you. Like, I just think that's the coolest thing. So, of course, kids can handle contacts. Like, we all know that. But, like, of course they can. Couple more, marketing and growing. I know this was kind of the part one of this series, but marketing and growing this myopia program. These are a couple things that I do. So, of course, we talk about this with like every existing patient. And it's kind of that like batting 300 thing. Like, I'm going to tell you about it every single year, whether or not. And some parents they have told me to stop telling me about that because they don't want to hear about it anymore. And I'm like, fine. And then in their alerts, I'm like, just don't talk about, does not want to save kids' vision or whatever it is. But I talk to all the patients, all the existing patients, all the new patients. Informational nights are really cool. Social media is really cool to spread awareness. I'm not great at those things, to be honest. I'm not great. I wish I was a little bit better. I'm not great at that, but those are really great things to do. Educational materials, use Canva. I mean, I am not like, I love Canva. I think it's really fun to do, and I feel like I'm decent at it, but I'm like, have no marketing background. Like, I don't know anything about anything. So like, it's very user friendly. So you make your own material or pay somebody to do it, or go on the Myopia profile and just download their educational materials. It's literally for free on there. You can use theirs. Cooper Vision has a really cool, like a book that talks about like what myopia is and what's the concern, and here's like a scale of what can happen like when your kid's a -4 or -1, like this is what it looks like. Ask your rep to bring you some of those. They're the MySight like brochures. They're really cool. Give those things out. Just your success stories, your testimonials. I have a video on the next slide that I'll show you of one of my favorite testimonials. But like testimonials are really cool. They take work. They don't have to be as fancy as this one because like our marketing people like came in and videoed this one. I mean, it can be a YouTube thing. It can be an Instagram video reel thing. It can be pretty simple. Um, Talking with the ophthalmologist in my area, I do this, and I love that. The cornea specialists I talk to, the retina specialists I talk to, mainly because the early onset cataracts and the retinal detachments, or the myopic maculopathy that I'll be sending them. I talk to them about this. I invite them to listen to me give lectures about this. I try to go in and give them lunch, and I just try to talk about it. I send emails, no one answers, like one person answers. I send 50 emails. That's fine. But continue to grow your passion so that people know that this is what you like to do. I send my exam notes, like the exam summaries. My virtual assistant helps me with this. I'll just say like send pediatric exam summary, and it's like already a template, and they just like enter in like the blank that I need to enter in. to the children's pediatricians. Like the pediatrician didn't ask that. Nothing's wrong with the kid. Maybe they're an emmetrope, like whatever. But like they're gonna get these reports back saying like, oh, I checked for this, this, and this, and this, and I'm here if you need me. Especially when they are myopic and oh, just so you know, Johnny's gonna come in wearing glasses the next time that you see him. Our plan is going to be talking about myopia management, and here are some things. And it's a pre-made template, and I just have her enter the information into it, and then we fax it off to the clinic. And so I never hear anything back. Like, I don't hear, the peds don't call me, like, but it's something that I do that I feel like maybe they read it a couple times and they're like, oh, okay, that's another one of them. Hoop myopia is really neat. This is, you pay for this marketing. But Bob Migliani and his wife are up in the Northeast, and they created this like marketing platform that's like fantastic. We use it for dry eye, but the myopia side is even more embellished because that was like their pilot, that was their original. And it's how to communicate with patients like when they leave your room, like they're gone, so now I got to send them information. They said yes, they said no, they want to know more, they want to see a video, they want me to talk about it. It's a really robust platform that they have, so that QR will go to that, and that is really cool if you're looking to not do it yourself and have it automated. It's really slick. It has some like analytics and stuff in there too, so you can like monitor and watch. And the Myopia Collective, like that's a great one. I mean, go on there, be a part of the collective, let people know you're part of the collective. It's got really good marketing material on there too that you can post. They like update it seasonally, so you can just like take that and put it on your social media. That one's really neat to like to have. So all of those are ways to like try and grow your program. And then I'll say how I grew my program is like 8 years of just talking about it and parents telling other parents about it. I don't know. I'm not a marketing guru, and Bob would probably like say I was not doing it right, or I could have done it 100 times better with his stuff, because I'm sure that's true. But like I I just, word of mouth is word of mouth, and that's how we've grown ours. And it's like one patient at a time, and it's slow as molasses, but it's okay because you got to get better at it too as you're moving slow as molasses. Here's my video of my testimonial. So I hope you enjoy this.
I play volleyball at The Ohio State University. I played volleyball since I was in like third grade. And I started with glasses, then I moved on to contacts, and at first I loved it, but going from like little league to like high level competition where the rallies are longer, and especially at the collegiate level and in the Big Ten, it moves super, super fast. My contacts would like dry out in the middle of the play. Dr. Holland offered me the opportunity to do CRT lenses where it like reshapes my eye overnight. With my old contacts, I would not be able to focus on the bottom of the ball, but now I'm able to be more on my toes and see it before it happens. I didn't know the extent of how bad my vision was until I tried these new lenses. I can see so much clearer, and it's really just been a life-changing experience for me.
I mean, like, how cool is that? Kaya's been my patient for a long time, and I actually like, I'm pretty sure I talked to her about this for 5 years. Her prescription's like, it's like a -8, -250 still. Like it's insane. And Ortho is working awesome for her. And I was super nervous to even like try it because by this time she was like becoming really good at volleyball. And I was like, oh my gosh, like I'm just gonna like ruin her career or something. But I didn't let that imposter syndrome get me down. And Mark Cosgrove helped me and he was like, no, let's do it. So that was really cool. And so like it's like patients like that, testimonies like that is why I do it. Like these are the cool success stories. And like, yeah, I said I have like 100 patients. Like that's one patient. Like I don't have those all the time. But she is so cool, and she's now off doing her thing with Ortho K. And it's because, yeah, I had to talk to her for like 4 or 5 years beforehand. But just keep talking. So to kind of just recap, the four keys to my success with this in myopia management is to educate yourself and get super passionate. Patients can feel that. They know when you're like faking it. Like I feel like they sense your energy. They're like puppies or like babies. Like they just kind of get it. They can feel you. So if it's not your passion, that's fine. Like find an associate or maybe find a different like subspecialty or something. But like it really is my passion. I feel like it's so awesome. There's so many myopic patients out in the world right now that we can harness and help. So that's step number one. Number two is use the right, not the excessive or even the super expensive technology. Just use the right stuff that's for your clinic. Train and empower your staff. Your staff, you're only as good as your weakest link, right? Like your staff is who is supporting you. Support your in-house staff, support your virtual assistant staff, support your staff, and they will support you. And then align as a team for consistency. That's where the protocols come in. That's where the repetitiveness comes in. And that's where like the routine comes in. So when I'm talking to patients, I am confident. I know what's going on. And it doesn't have to be complicated.